question. I would now like to turn the call over to Ms. Ann Stock. Ma'am, you may begin.
Great, thank you. Good afternoon, everyone, and thank you for joining us today. My name is Ann Stock, Team Lead for Policy, Technical Assistance, and Communications here in the Division of Home Visiting and Early Childhood Systems in HRSA. Today I am joined by two colleagues, Susan Marsiglia-Gray, Supervisory Team Lead, also in the Division of Home Visiting and Early Childhood Systems at HRSA, and Amanda Coleman, Senior Social Science Analyst in the Office of Planning, Research, and Evaluation at the Administration for Children and Families. We're very excited to be here with you to walk through the draft Pay for Outcomes Supplemental Information Request, or PFO SIR. The PFO SIR is the mechanism by which we are releasing guidance to MIECHV awardees for how to meet the statutory requirements associated with implementing a Pay for Outcomes, or PFO, initiative. Our goal for today's webinar is to walk through the content of the draft SIR in order to help you to provide comments on the SIR through the 60-day Federal Register Notice, or FRN, that is currently seeking public comment on the draft SIR. As a reminder, comments are due by September 8th. If you have not already, we strongly recommend that you email paperwork@hrsa.gov and reference MIECHV Pay for Outcomes in your message to obtain a copy of the draft guidance. Please note that before the SIR is finalized, we will also be releasing a 30-day FRN to seek comment on a revised version of the SIR. A final version of the PFO SIR will be available no earlier than the end of the calendar year 2020. The draft SIR guidance includes two parts, a Word document with detailed instructions for responding to the SIR and a work plan timeline Excel template. Today, Susan, Amanda, and I will walk through the draft SIR instructions. There will be time for Q&A at the end of the presentation. I also want to note before I begin that on Wednesday, this Wednesday, July 22nd, from 3 to 4:30 p.m. Eastern Time, HRSA will be hosting a listening session. This listening session is focused on the MIECHV legislative changes from the Bipartisan Budget Act of 2018 that includes Pay for Outcomes, Demonstration of Improvement, Data Exchange Standards, and the Needs Assessment. During this session, we'll be soliciting feedback on how awardees and stakeholders were engaged in the operationalization of these new authorities and requirements, and how HRSA can continue to facilitate and offer meaningful opportunities for public engagement on the development of program policy. So we hope you will join us on Wednesday, this coming Wednesday in 2 days, July 22nd from 3 to 4:30 p.m. Eastern Time. Before we begin the presentation, I'd like to review a few webinar logistics. Phone lines will be muted during the presentation. At the end of the presentation, we will open the phone lines to take your clarifying questions. You may also enter questions in the chat box, but we will hold on responding to them until the question and answer section of the webinar. Following the webinar recording will be made available and shared on the MIECHV website, along with other MIECHV PFO technical assistance resources as they're available. Now that we have the technical aspects of our webinar covered, let's review our agenda for today. First, we will provide background information on the development of the PFO SIR guidance, including the statutory requirements of a PFO initiative, the potential benefits and opportunities associated with implementing a PFO initiative, the guiding principles for implementation, and the application process. Then we will walk through in detail two key sections of the PFO SIR, the PFO SIR requirements and the instructions for responding to the SIR. We will then discuss the application process and next steps. Lastly, we will have time to answer your questions. Now I will turn it over to Susan Marsiglia-Gray, who will share some background about the development of the PFO SIR.
Thank you, Ann. As you all know, the Bipartisan Budget Act of 2018, which extended the MIECHV program, also created new legislative authority that allows for MIECHV awardees to use a portion of their MIECHV formula grant for a Pay for Outcomes initiative. The legislation defines a Pay for Outcomes initiative as a performance-based grant contract cooperative agreement, or other agreement awarded by a public entity in which a commitment is made to pay for improved outcomes achieved as a result of the intervention that result in social benefit and direct cost savings or cost avoidance to the public sector. To meet statutory requirements, a PFO initiative must include a feasibility study that describes how the proposed intervention is based on evidence of effectiveness, a rigorous third-party evaluation that uses experimental or quasi-experimental design or other research methodologies that allow for the strongest possible causal inferences to determine whether the initiative has met its proposed outcomes as a result of the intervention, an annual publicly available report on the progress of the initiative, and a requirement that outcome payments be made to the recipient of a grant, contract, or cooperative agreement only when agreed upon outcomes are achieved. This requirement excludes payments made to the third party conducting the evaluation. In the following sections, we'll describe how the PFO SIR accounts for each of these statutory requirements. The legislation also included several other key provisions related to the implementation of the PFO authority. It placed a limit on the amount of funds that could be used for PFO outcomes payments to 25% in an awardee's grant that will not result in a reduction of funding for home visiting services delivered by the entity while the eligible entity develops or operates such an initiative. Statute further allows for funds for a PFO initiative to be available for up to 10 years. We will talk more about how that is operationalized in a later part of today's presentation. HRSA anticipates that implementation of a PFO initiative has the potential to result in a number of benefits and program improvements. For example, implementation of a Pay for Outcomes initiative may improve service delivery and performance, strategically target and invest in new or underserved populations, leverage additional funding sources into the delivery of home visiting services, improve data capacity, particularly regarding program performance and achievement of outcomes, strengthen stakeholder engagement with families, communities, service providers, other government entities, evaluators, intermediary organizations, and experts with data capacity, and improve government processes and procurement by emphasizing improved performance management, data capacity, and evaluation. HRSA developed the PFO SIR guidance for Pay for Outcomes initiatives with 4 main guiding principles in mind. First, we had to ensure that the guidance aligned with applicable statutory requirements and reflected statutory intent. Second, we worked from the premise that a PFO initiative should meet the needs of states, communities, and families. Implementing a PFO initiative should not disrupt or negatively impact communities that have benefited from evidence-based home visiting services. It is not the intent to shift resources away from underserved communities. Third, the guidance must provide direction and succinctly outline the requirements for a PFO initiative. Finally, we recognize that exploring and implementing a PFO initiative requires a significant amount of time and effort, and HRSA is committed to an approach that provides you with flexibility, direction, and technical support in order to minimize that burden. We will dig deeper into the application process later, but I also wanted to provide a brief overview here for context. Beginning with the fiscal year 2021 formula funding application, MIECHV awardees can choose to budget for one of 3 things as they relate to PFO. An awardee can budget MIECHV funds for a PFO feasibility study. An awardee can budget MIECHV funds for a PFO initiative, which refers to outcomes payments and the evaluation. Or an awardee can budget nothing for a PFO initiative and continue service delivery and operation as usual, as implementation of a PFO initiative is optional and not required. To start, we have step 1, complete a PFO feasibility study. A feasibility study must be completed prior to applying to use MIECHV funds for PFO outcome payments and PFO evaluation. Funds used for a feasibility study follow the typical MIECHV period of availability, so are available for 2 years. If you are budgeting for a feasibility study, you do not need to submit a SIR response. Next, we have step 2, applying to use MIECHV funds for a PFO initiative, meaning outcome payments and PFO evaluation. Once the feasibility study requirement has been met, you can choose to apply to use MIECHV funds for outcomes payments and the PFO evaluation. Funds used for these purposes are available for up to 10 years. If you choose to apply for MIECHV funds for PFO outcomes payments and the PFO evaluation, you will also need to complete step 3, submitting a SIR response. If you receive preliminary approval from HRSA to use MIECHV funds to implement a PFO initiative through approval of your fiscal year 2021 MIECHV application, you must submit a response to the PFO SIR 120 days after the start of the project period during which the PFO initiative is funded. Once received, HRSA will review your SIR response. You are not able to begin implementation of the PFO initiative until you receive HRSA approval. Once you have received HRSA approval, you are set to implement the PFO initiative. PFO initiatives that include outcomes payments and PFO evaluation must be completed no later than 10 years from the date the funds are made available. The PFO SIR is intended to complement instructions for how to apply to use MIECHV funds for PFO, which will be included in the fiscal year 2021 MIECHV formula notice of funding opportunity. These instructions will be included in all subsequent MIECHV formula no-flows or non-competing continuation update guidance after fiscal year 2021 as well. Now I'll turn it over to Amanda to discuss the PFO SIR requirements.
Thank you. So the PFO SIR provides detailed information about the requirements for a PFO initiative. We're going to talk through each of these requirements in more detail, but the requirements for PFO that are outlined in the SIR are related to 1, the feasibility study, outcome measures and payments, the third-party evaluation, the requirement that the implementation of a PFO initiative cannot result in a reduction in funding for services, the PFO statutory period of availability, funding limitations, and the annual publicly available report. First, to reiterate, statute requires a PFO feasibility study be conducted as part of a PFO initiative. Feasibility studies are intended to assess the likelihood of a PFO initiative's success, as well as to provide critical information for deciding whether to launch a PFO initiative. Meeting the feasibility study requirement can be done in 2 ways. First, you can complete a new MIECHV PFO feasibility study using MIECHV funds, or you can submit a non-MIECHV funded feasibility study that was completed within the last 5 years that assesses the same intervention and target populations you are proposing in the PFO SIR response and meets the PFO feasibility study requirements. Instructions for completing a PFO feasibility study can be found in Appendix A of the PFO SIR guidance and will also be in the FY21 NOFO. The second requirement relates to outcome measures and payments. For the purposes of PFO, an outcome is defined as a positive impact on a target population that you expect to achieve as a result of the intervention over the duration of a project. That outcome is measured by indicators that are observable during the project period. One or more outcomes may be selected for a PFO initiative, but to ensure consistency and alignment with the MIECHV program purpose, all selected outcome measures must align with the 6 MIECHV benchmark areas. You are not required to address each benchmark area. You may choose impact outcomes, process outcomes, or both, as long as the methodology for evaluating whether or not the outcomes have been achieved allows for the strongest possible causal inference. Outcome payments can only be made for outcomes that are included in the PFO evaluation and can only be made after the evaluator has determined whether the outcomes have been achieved. Awardees proposing a PFO initiative may choose to allocate up to 25% of their MIECHV award for outcome payments only. The 25% does not apply to funds allocated to support other aspects of a PFO initiative, such as feasibility study, PFO evaluation, reporting on a PFO initiative, data systems, etc., which may exceed the 25% limit. The third requirement relates to the third-party evaluation. The evaluation, which must be conducted by an independent third party, must use a research methodology that allows for the strongest possible causal inference to determine whether the initiative has met its proposed outcomes as a result of the intervention. The evaluation is not required to show statistical significance in order to trigger an outcome payment. In addition to the primary purpose of a PFO evaluation, which is to determine whether the outcomes in the PFO initiative have been met, we also see PFO evaluations as contributing to the MIECHV learning agenda, building evidence for the home visiting models implemented, as well as providing critical information for continuous quality improvement efforts. The fourth requirement is related to the statutory requirement that implementation of a PFO initiative does not result in a reduction in funding for services as delivered by the MIECHV awardee compared to the year prior to the initiation of the PFO initiative. This requirement applies to all of the expenditures associated with a PFO initiative, including but not limited to outcome payments, costs associated with implementing an evaluation, costs associated with conducting a feasibility study, the portion of implementation and administrative costs associated with the PFO initiative, and any PFO reporting costs. The fifth requirement is related to the period of availability for funds related to PFO. Funds budgeted for a PFO initiative within a fiscal year will remain available for up to 10 years. The PFO statutory period of availability, that 10-year period of funding availability, applies to MIECHV funds allocated for outcome payments and PFO evaluation funds. Because of this period of availability, the project period of a PFO initiative cannot exceed 10 years. However, you can plan for it to be shorter than 10 years. Any grant funds that have not been obligated for expenditure by the recipient during the period of availability will be deobligated. All other expenses related to a PFO initiative, such as those associated with conducting a feasibility study, contracts, data capacity expenditures, etc., are subject to the standard statutory MIECHV period of availability, so the normal 2 years. So funds that are awarded for a fiscal year will remain available for expenditure through the end of the second succeeding federal fiscal year after award. Specific instructions for budgeting for a PFO initiative will be available in the FY 2021 NOCO. Exhibit C from the SIR provides an example of how the two periods of availability coincide: the standard MIECHV period of availability and the PFO statutory period of availability. The standard statutory MIECHV period of availability applies to all funds
except for those allocated for outcome payments and PFO evaluation. For the FY21 project period, assuming awards are made by September 30th of 2021, the period of availability ends on September 29th of 2023. The PFO statutory period of availability applies only to funds allocated for outcome payments and PFO evaluation. For the FY21 project period, the period of availability ends on September 29th, 2031. In order to minimize the likelihood of deobligation, MIECHV funds that are budgeted for outcome payments and evaluation can only be rebudgeted back to activities associated with standard MIECHV implementation. So any activities except PFO initiative outcome payments and PFO evaluations. This can be done within the first 12 months of the PFO statutory period of availability. So in this case, that would be September 29th, 2022. The sixth requirement relates to funding limitations, the administrative and infrastructure expenditure cap. MIECHV funds budgeted for a PFO initiative are subject to the 10% limit on use of funds for administrative expenditures and the 25% limit on use of funds for recipient-level infrastructure expenditures. Both of these caps apply to the total MIECHV formula award. For the 10% administrative expenditure cap, this includes typical MIECHV program administration and any costs associated with PFO administration. This also includes activity costs associated with a PFO initiative that would typically be subject to the 10% administrative cap, such as reporting costs, subrecipient monitoring expenses, etc. For the 25% limit on recipient-level infrastructure expenditures, that includes any cost for the PFO initiative activities that are typically subject to the 25% recipient-level infrastructure limit, such as professional development and training for recipient-level staff, model affiliation and accreditation fees, technical assistance provided by the recipient to the local implementing agency. The seventh and final requirement relates to the PFO annual progress report. Statute requires a publicly available annual report on the progress of the PFO initiative. The annual report is due to HRSA no later than 90 days after the end of each federal fiscal year during implementation of the PFO initiative. Additional instructions for submission of the report will be provided by your HRSA project officer no later than 90 days before the progress report due date. Now I'll turn it over to Anne to describe the instructions for responding to the PFO SIR.
Thanks, Amanda. A complete PFO SIR response includes a PFO narrative and 3 attachments: a PFO work plan timeline, a completed feasibility study, and partnership agreements with key stakeholders. Before I dig into what must be included in the PFO narrative, I will take a few minutes to discuss the required attachments. Attachment A, the PFO work plan timeline, must extend across the entire length of the proposed PFO project period and include start and completion dates for activities. The proposed project period should be clearly articulated and should reflect the appropriate amount of time needed to observe and achieve the outcome measures, complete the PFO evaluation, and ensure that funds are obligated within the PFO statutory period of availability, which, as a reminder, is 10 years. Attachment B, the PFO feasibility study, must be submitted as part of the complete PFO SIR response. Attachment C includes signed partnership agreements with each key PFO partner that articulates clearly defined roles and responsibilities of each partner, an assurance that all partners have reviewed the evaluation plan, is an agreement by all relevant partners to cooperate in the implementation of the evaluation. A list of the key PFO partners with whom partnership agreements are required is included in the draft SIR. Finally, just to reiterate, a SIR response is only required for awardees applying to use MIECHV funds for outcome payments and evaluations related to a PFO initiative, not for awardees proposing feasibility studies. Section 4 of the draft SIR provides extensive instructions for what awardees must report on in their PFO narrative. The key sections that must be addressed in the narrative are listed here on the slide. I will describe the reporting requirements for each of these narrative sections in the following slides. The narrative is intended to ensure that HRSA has enough information about your planned PFO initiative to ensure that it meets the statutory requirements. First, we'll walk through the introduction and project summary. Your PFO narrative should begin with an introduction that describes the purpose, goals, and approach for your PFO initiative. You will then describe why you believe PFO is an appropriate strategy for achieving MIECHV program goals. The section should include the specific goals of your PFO initiative, as well as a high-level project summary. The second section of the PFO narrative is the PFO feasibility study summary. As noted earlier, a PFO initiative must include a feasibility study, which describes how the proposed intervention is based on evidence of effectiveness. The feasibility study also serves as a tool to determine the viability of using a MIECHV PFO approach to meet the proposed outcomes, while still meeting all MIECHV statutory and program requirements. In this section of your PFO narrative, you must provide a summary of the results and key findings of your PFO feasibility study, the primary benefits and assets associated with implementation of a PFO initiative, the primary risks and challenges associated with implementation of PFO, and how the feasibility study determined that a MIECHV PFO initiative can be implemented and funded without causing any reduction in funding for services. The third section of the PFO narrative describes your target population and evidence-based models being implemented. Here you will describe the evidence-based models you will implement as part of your PFO initiative, the at-risk communities you will serve through the PFO initiative based on the findings from your most recent statewide needs assessment, the participating LIAs and number of families that will be served by them, your total MIECHV caseload of Family Plus, noting which will be served as part of the PFO initiative. You will also discuss any anticipated barriers to enrolling eligible families in the PFO initiative and proposed solutions. Finally, if you are leveraging non-MIECHV funding as well, you will also be asked to note the number of families served with MIECHV funds versus non-MIECHV funds. The fourth section of the PFO narrative addresses the PFO initiative key stakeholders and partnership structure. PFO initiatives require and benefit from the involvement of many partners, including LIAs, third-party evaluators, model developers, agencies that house administrative data sources, early childhood systems partners, home visitors, families, and others. They may also include investors or an intermediary organization, though neither is required. In this section, you'll be asked to describe key partners and any collaboration with external partners, including the partnership structure. Note your plan for communicating about the PFO initiative with home visiting service providers and families served. Identify challenges and propose solutions to engaging families. And if external funders are involved, describe their role and funding amount. The fifth section of the PFO narrative is the PFO budget and budget narrative section. The goal of the PFO budget and budget narrative is to expand on and complement your most recently approved MIECHV budget and budget forms that are submitted through your MIECHV formula funding application, and to provide a more detailed description of how each budgeted line item will support the achievement of the PFO initiative's proposed objectives. For the PFO budget and budget narrative, you'll be asked to provide 2 line item budget narratives, one for PFO outcome payments and evaluation, and the other for any other PFO-related expenditures budgeted under the standard MIECHV formula award. This section of the PFO narrative is not intended to replace your most recently approved MIECHV budget and relevant budget forms. In fact, if there have been no changes to these budgets as they were proposed in your funding application, beginning with the FY 2021 funding application, the line item budget narrative can be copied from that funding application. If there have been changes, you will need to highlight those changes in the SIR response and submit the changes through a prior approval request. The sixth section of the PFO narrative describes the selected outcome measures for the PFO initiative, including how each outcome measure is aligned with the MIECHV benchmark areas, how at least one outcome measure aligns with one of the 19 MIECHV constructs, the evidence that the selected intervention, or the evidence-based home visiting model, can be expected to produce the selected outcome, and how the proposed outcome measures for the PFO initiative are reflective of federal, state, and/or local public sector cost savings, cost avoidance, and/or social benefit. The seventh section of the PFO narrative addresses the outcome payments criteria and timing. In this section, you will describe how outcomes will be measured and how you will know when you have achieved the desired outcome. List the payment amounts for each outcome measure and the rationale and method for determining that payment amount. Describe how the payment amount is appropriate and reasonable relative to the outcome measure and based on anticipated cost savings, cost avoidance, and social benefit. Note the payment schedule timeline for outcome measures and specify to whom the payments will be made. The eighth section of the PFO narrative addresses the statutorily required third-party evaluation and asks you to describe the critical elements that will be included in the evaluation of the PFO initiative, which are the entities or organizations responsible for designing, collecting, analyzing, and reporting evaluation data, the evaluation research questions, the evaluation design, outcomes measured, data collection methods and schedule, sample size and sampling plan, the analysis plan, study limitations, evaluation timeline, and estimated power to detect impacts and/or comparison group, if applicable. Detailed instructions for responding to each of these critical elements is included in the draft SIR. The ninth and final section of the PFO narrative is the verification and assurances section. As noted earlier in the presentation, MIECHV statute requires that PFO initiatives must not result in a reduction of funding for services delivered by the recipient entity administering the MIECHV home visiting program. In this section, you will provide two assurances to that end. The first is an assurance that there will be no reduction in funding for home visiting service delivery as a result of the PFO initiative. The second, we ask for an assurance that there will be no anticipated reduction in caseload of family slots as a result of the PFO initiative. Now we'll turn it back to Susan to discuss the PFO application process and next steps.
Thank you, Anne. As a recap, here are the 5 stages of the PFO initiative development, application, and reporting process. Step 1, complete a PFO feasibility study. You can use non-MIECHV funds to complete a PFO feasibility study or apply to use MIECHV funds for a PFO feasibility study beginning with the fiscal year 2021 formula funding application. Step 2, apply for MIECHV funds for a PFO initiative. Once you have completed a feasibility study, you can choose to apply to use MIECHV funds for a PFO initiative, which means outcome payments in the PFO evaluation, beginning with the 2021 MIECHV formula funding application. If you're applying for MIECHV funds for PFO outcome payments and PFO evaluation, you also have to complete step 3, which is submitting the PFO SIR response. If you receive preliminary approval from HRSA to use MIECHV funds to implement a PFO initiative, you must submit a response to the PFO SIR 120 days after the start of the project period during which the PFO initiative is funded. Once the SIR response is approved, you can move on to step 4, which is PFO initiative implementation. PFO initiatives that include outcome payments and PFO evaluation must be completed no later than 10 years from the date the funds are made available. Finally, step 5 is the annual progress report. Throughout step 4, the implementation phase, you are also required to produce an annual publicly available progress report on the PFO initiative. When you submit a PFO SIR response, HRSA staff will review applications for completeness and compliance with the SIR requirements and will either accept the submission as is or request additional information or clarification. Awardees cannot begin implementation until HRSA approves the complete submission to the PFO SIR. This slide describes anticipated activities related to the implementation of the PFO authority over the next 2 years. In early 2021, we anticipate that the final SIR guidance will be released. The final PFO SIR guidance will articulate how awardees can demonstrate that they are meeting HRSA's instructions for a PFO initiative, beginning with fiscal year 2021 MIECHV funding. In spring of 2021, the MIECHV fiscal year 2021 NOFO will contain requirements and instructions for budgeting for and proposing a PFO initiative with fiscal year 21 MIECHV funds. Instructions will be provided and awardees will be able to apply for funds for a feasibility study or a PFO initiative that includes outcome payments and PFO evaluation as part of their fiscal year 21 formula funding application. In September 2021, the 2021 formula awards will be issued and project officers will issue requests for information, or RFIs, requesting a response to the PFO SIR guidance to those awardees who requested funding for PFO outcome payments and PFO evaluation in their funding applications. In January 2022, 120 days after the project start date, those awardees will submit their response to the PFO SIR. Finally, September 2022 will be the deadline for when awardees can re-budget PFO initiatives back to the regular MIECHV allocation if they opt not to pursue a PFO initiative. Note that for applications approved for PFO initiatives, so those that include outcome payments and evaluation, the Notice of Award, or NOA, will contain 2 document numbers to enable HRSA to track PFO funds for outcomes payments and evaluation over their 10-year period of availability and the regular MIECHV funds over the regular 2-year period of availability. Before we open the presentation up for questions and discussion, I wanted to remind everyone of the next steps. As a reminder, a 60-day Federal Register notice is currently seeking public comment on a draft of the SIR. Comments during the 60-day period are due September 8th. If you have not already, we encourage you to email paperwork@hrsa.gov and reference the MIECHV Pay for Outcomes in your message to obtain a copy of the draft SIR. Following the 60-day Federal Register notice comment period, there will be a 30-day Federal Register notice to seek comment on a revised version of the SIR. The final version of the SIR will not be available until December 2020 at the earliest. HRSA will also be continuing to develop targeted and universal technical assistance products and opportunities that will be available to support awardees in implementing PFO. Please be on the lookout in the MIECHV Home Visiting Digest for future TA resources. We now will open the presentation up to any questions that you may have. Operator, can you please instruct participants how they can ask a question?
Yes, ma'am. Thank you. If you would like to ask a question, please press star 1 on your phone, unmute your line, and record your name clearly. Once again, to ask a question, please press star 1, unmute your phone, and record your name clearly. One moment for your first question. I'm currently showing no questions at this time. Once again,
Sure.
to ask a question.
Yeah, I was just going to say we'll hold for a few more minutes to see if any questions come in. And also want to know for those who are listening through the Adobe Connect and not on the telephone line, please feel free to enter any questions you may have into the chat function.
And we still currently have no questions at this time.
Let's give it 2 more minutes, and then if we don't have any other questions, we will conclude the webinar.
Once again, if you would like to ask a question, please press star 1 on your phone, record your name clearly. One moment.
Okay, sounds like there are not any questions, so that concludes today's webinar. And again, just a reminder to please respond with any comments you might have to the Federal Register notice. Thank you.
This concludes today's conference. All participants can disconnect at this time. Speakers, stand by.